For how many of you is sleep a priority? Sleep. Who wants to learn about sleep? Okay. Oh, so a good chunk of us. Okay, so I'll spend a little more time on that. And if I don't cover what you want me to cover, just ask. Anything else you want me to cover?
Pain.
Pain. Okay. Pain from foods and exercise. We may touch on that very briefly, not too much, but hey, come to my next talk. Yes. How to have more energy is going to be a big part of what we're going to cover today. Christina?
Maybe
Mood.
the mood.
How to improve the mood. Yeah, that's what everything what it's about today. And Carol, right? Good.
Hormones and nutrition.
Hormones and nutrition. That's a big part of what we're going to be talking about today. Sorry? How to improve your memory. Great. Have more sex. Just kidding. Kind of. Not. What else?
Depression.
Depression. Yeah, that's about like 1/3 of what we'll cover today. Yes.
Anxiety.
Anxiety and depression are the two biggest things we're going to cover today. The first section will be anxiety, the second section will be depression. Great. Anything else? All right, let's get to it. So here's the agenda for today. What we'll cover is, I'll give you a little bit of my background. So who am I? Why am I up here? Then we're going to talk about exercise prescription for anxiety. So first of all, what is anxiety? And the second thing is, how do you manage it from an exercise perspective? Now, I use that word prescription very specifically, not just recommendation, but prescription. I'll give you the example. When your doctor prescribes a certain medication, he prescribes it. He says the name of the medication, he tells you the dosage, he tells you when you should take it, and with or without food. That's precise. When your doctor tells you you should exercise, he leaves it at that. Well, what should you do? Should you lift weights? Should you go for a walk? Should you do yoga? Should you stretch? How many times a week? At what intensity? But you don't get those details because your doctor usually doesn't know. Okay, he's just not trained in it. And here you'll get very precise idea of how to exercise, what's the right frequency, what's the right type of exercise, strength training versus cardio, etc. for these types of conditions. What works for one condition may not work for another. So we'll talk about exercise prescription for anxiety, exercise prescription for depression, and mechanisms. Why does exercise work? It's cool to know that it works. That's like the bottom line, but how does it work? I'll give you 6 mechanisms by which it works. Then we'll talk about the nutrition side of things, and nutrition for improved mental health. So nutrition is not just about eating right and exercising, it's also about correcting hormonal imbalances, it's also about correcting digestive issues, and so on. So we'll address all those things. Then we'll talk about the hidden causes of mental health issues. People frequently think that mental health is just in the brain. The truth is that mental health can extend beyond the brain. The origins of mental health issues can be in seemingly unrelated issues. For example, more than 50% of people with depression have a slow thyroid. I should correct that. More than 50% of people with depression have an undiagnosed slow thyroid. Okay? A lot of people with depression just have low B12, folic acid, and B6 levels. Okay? Some people with depression and anxiety, especially anxiety, have low levels of serotonin because of digestive issues. Who would have ever connected a digestive issue to the brain, to a mental health condition? So I'll talk about the hidden reasons behind mental health issues. Finally, I'll tell you a little bit about our services, how we can help you be happier, more stress-free, as well as lose weight and get stronger, and so on. Okay? So let's get to it. All throughout high school, so my background, all throughout high school I wanted to help people lose body fat, get stronger, be happier, have more energy, and so on. So as soon as I graduated from high school, I pursued my degree in kinesiology at York University, plus I was working as a personal trainer at a community center and a country club. Unfortunately, only about 15 to 25% of my clients were getting the results that they wanted. Very disappointing considering I was implementing those best practices in the industry. So then I started to incorporate nutrition into my practice. And no surprise, when I combined exercise plus nutrition, success rates went up. Now they went up from 15 to 25% up to 35 to 45%. Much better, but still a lot of my clients were not getting the results they wanted. Funny as it sounds, they don't really teach nutrition kinesiology degrees or personal training certifications. So that's why it wasn't incorporated earlier. But again, 35 to 45% success rate in the personal training industry is decent, but my ego couldn't handle not getting results with clients. So at that point, I had a client who, for the purposes of this presentation, I'm going to call Menopausal Mary. Menopausal Mary was doing everything right. She was eating right, she was exercising, and still not losing body fat. Very frustrating for her, very frustrating for me. By the way, nobody here is named Mary, is she? I should have asked. So nothing was going her way. Like, she was exercising right, she was eating right, just the weight couldn't budge. And the frustrating thing is, up until the age of about 49, she was a slim, trim, 120 pounds at 5'9". Great shape. Then without any changes in exercise and nutrition, body fat was gained, and mostly of it around the belly. Very frustrating. And it wouldn't budge no matter what. So again, my ego couldn't handle not getting results with clients. So what I did was I spent the next 3 years and $20,000 on top of my university education studying about the connections between hormones and body fat and mental health, and digestion, body fat, mental health, stress levels, body fat, mental health, all that kind of stuff that's extremely important, but unfortunately is not taught in kinesiology degrees or personal training certifications. As a result, I was able to help a lot more of my clients, and we started to develop a reputation for helping people with difficult cases, people who other health professionals or personal trainers weren't able to help. Here's a few examples. This is a picture of Vicky. In this picture, she is 51 years old, and when she came to us, she was exercising 5 days a week. 4 of those 5 days, she was doing it twice a day. So she was exercising 9 times per week. Okay, lots of exercise. Despite that, she wasn't losing the fat that she wanted. Okay, her biggest problem area was the backs of her arms and her belly. Okay, again, frustrating to get no results when you're exercising that much. All she wanted to do was lose 5 pounds. As a result of changing a few things about her exercise and nutrition, she was able to lose 13 pounds of fat while simultaneously gaining 3 pounds of muscle. So she was very happy. She just had one little problem. She had to buy new clothes. Very unfortunate. Another one of our happy case studies. This is David, who was actually in this seminar 2.5 years ago. And in this picture, he's 71 years old. And his entire life, including in his teens, in his 20s, and his 30s, he had this big round stomach. He was always bloated, all the time. He was even working with a personal trainer for 4 years before he came to start working with us. And in a matter of about 6 months, he was able to lose 4 inches off his waist. And for the first time, at age 71, he actually had a flat stomach, which again, he did not have as a teenager or in his 20s or 30s. Another quick case study, Brittany. She is actually our youngest client. In this picture, she's 23. But the only thing she had going for her was her youth. She had nothing else going for her. Genetics, not good. Her parents, her brothers, everybody was overweight. Okay. Logistics, not good. So she had to travel quite a bit to get to our gym. Like, a lot of stuff going against her. The only thing she had going for her was her youth. She's tried a lot of stuff, yo-yoed up a lot. And within 2 weeks, she was able to lose 1 inch off her arms and 3 inches off her waist. So she was pretty happy with that. And lastly, Rick. In this picture, he's 51 years old, busy accountant. As you know, between January and May, they're working 12 to 14-hour days. Despite that, he was able to lose 4 inches off his waist in a period of 3 months and get a lot stronger. Okay, so we kind of developed a reputation for being able to work with difficult cases and stuff for people who haven't had success in the past. As a result, I was selected as one of the top 5 personal trainers in Toronto by the Metro News newspaper, and eventually came out with this book called Stop Exercising the Way You're Doing It Now. My publisher told me to say it with a pause, so I say it with a pause. So what is it about? It's about pretty much all the stuff you guys asked me about today. What are the best foods to eat? What are the most nutrient-dense foods to eat? How should you exercise? Which supplements should you take? How do you balance your hormones? How do you improve your digestion? How do you sleep better? There's a big section in there on sleep, and so on. And so this has been getting some publicity, including Globe and Mail, Morningstar magazine, Globe and Mail, Health Executive Today, Global, CFRB, and others. And so I've been asked to be a guest expert in various different television programs. This program is called I'm Every Woman. That particular episode was about the hormone-body fat connection during menopause. Rogers Television, and eventually more and more of my talks that were open to the public started attracting other personal trainers. At the end of the seminar, the trainers would approach me saying, that was great information, but we never learned this in our kinesiology degrees or personal training certifications. How do we get this information? I told them exactly what to do. Spend the next 3 years and $20,000 on top of your university education, and you'll be able to help them a lot better. They didn't really like that answer. So what I did was I created a mentorship program. The mentorship program is a one-day crash course that teaches personal trainers everything that they did not learn in kinesiology degrees, personal training certifications, and so on. Additionally, in the past Proceeds from seminars I've done have gone on to the Alzheimer's Society of York Region, Heart and Stroke Foundation of Ontario, as well as others. So now let's get to the fun part of mental health. Generalized anxiety disorder. Who can give me a definition of that? What would you say anxiety is? GAD, generalized anxiety disorder. Any ideas? Yes?
Not being able to cope with the daily demands.
Not being able to cope with daily demands. Great, that's one of the symptoms. There are 6 symptoms. Yes?
Like you're always thinking that the worst would happen?
Yes.
In any situation?
Persistent worry. Great. Anything else? Yes.
In certain situations.
One more time?
Attacks in certain situations.
Attacks in certain situations. Great. Those are 3 of the 6 symptoms. So again, there are 6 symptoms. You need to meet 3 of the 6 to actually be diagnosed as having anxiety. In addition to that, these symptoms must cause social or occupational impairment. They must persist for 6 months or longer. They cannot be attributed to any other medical conditions or medications. Okay? If you meet all those criteria, that's the psychiatric criteria. It's in a book called DSM-4. If you can meet all the criteria, you're diagnosed as having anxiety, generalized anxiety disorder. So that's the definition. Now, how do we measure anxiety? Obviously, it's not something you can see in the blood. It's not something you can see like blood sugar or blood cholesterol. So how do we measure it? Through symptoms. The primary questionnaire that assesses symptoms for anxiety is called the State Trait Anxiety Inventory. State Trait Anxiety Inventory. So you fill out this questionnaire, and based on that, it says whether you have anxiety or whether you don't. Now, the title of that is very important. State trait. I want to emphasize that. State trait. So there's 2 types of anxiety: state anxiety and trait anxiety. Does anybody know the difference between state and trait anxiety? Well, state anxiety is just your anxiety in a particular moment, in a particular snapshot in time. So if you have a stressful situation, you'll be anxious right then and there. But outside of that, you're not anxious as a person. Trait anxiety is how neurotic are you, okay? That's your predisposition as a person. So that's the difference between state anxiety and trait anxiety, and this measures both, okay? So let's figure out what type of exercise is best to manage anxiety. So what I'd like to do is I'd like to not base it on my opinion. I like to base it on research, what's been tried, tested, true, and proven. So I'm going to give you a bunch of studies where they actually took people who had anxiety or depression, whatever we're talking about, and they modified certain protocols with them and saw what's the best effect. So here's what they did. In one study, researchers took 26 well-conditioned college athletes with anxiety, and what they did with them is they did this. They divided them up into 2 groups. Group 1 cycled for 30 minutes at 70 to 80% of their maximal heart rate. Group 2 did the same thing, but they lifted weights. Okay? So intensity and duration were identical. Intensity was 70 to 80% of your maximal capacity, and duration was 30 minutes. The only difference was strength training versus cardio. Who says cardio group did better? Who says strength training group did better? Cardio group, put your hands up again. Okay. Why cardio, in your opinion?
Gut feeling.
What's that?
Well, maybe because circulation, improved circulation.
Improved circulation, great. Strength training group, hands up. Okay. Leroy, why?
I don't know, I just felt like I had read something recently about how like prolonged cardio can like be more stressful to your body than like just going for a walk or something.
Yeah, so higher intensity cardio can be more stressful to the body than going for a walk. Correct. Now that you hear each other's opinions, does anybody want to switch? Just checking. Stick to your convictions. Here were the results. The cycling group, the group that did cardio, their anxiety levels after exercise were lower than baseline. In other words, cardio at 70 to 80% of your maximal heart rate for 30 minutes reduced anxiety. Great. Strength training group did not. In the strength training group, anxiety levels after exercise were elevated. So they were more anxious after the exercise than before exercise. Now, is that to say strength training is not effective for anxiety? No. That's to say that there's still, this protocol of strength training is not effective for anxiety, so that intensity and that duration is not effective, okay? But there are still a lot of unanswered questions about strength training, such as, what about intensity? Okay? Sorry, I'll answer questions. What about intensity? So in this study, they made them exercise at 70 to 80% of the maximal amount of weight that they were able to lift. Well, what if they had exercised at 50% or 90%? We don't know. It's an unanswered question. What else? What about the recovery period? In this study, again, baseline was a certain amount, and then they exercised, and the anxiety post-exercise for the strength training group was higher than baseline. But that's just immediately after exercise. What about an hour, or 2, or 3, or 4, or a couple of days after exercise? Again, we don't know. As it stands right now, all we can say definitively is that exercise at 70 to 80% of your maximal strength training, specifically at 70 to 80% of your maximal capacity for 30 minutes is not effective. Again, a lot of unanswered questions, but that specific protocol is not effective. Okay? So, what is the right exercise intensity to reduce anxiety? Well, 70 to 80% seems to work fairly well. Okay? More intense doesn't seem to work fairly well. Exercise duration. So in most studies, start at 20 minutes. But that's kind of like, that's what's proven to enhance aerobic fitness. Okay? So if you're going for aerobic fitness, 20 minutes is the minimum. But what if you can improve your mental health, you can decrease your anxiety independent of any improvements in aerobic capacity? In other words, your fitness doesn't increase, but your mental health improves. So most studies look at 20 minutes because that's what it takes for fitness improvements. So some studies actually directly looked at what's the minimum amount of exercise necessary to reduce anxiety. 2 studies have found that 10 to 15 minutes is enough to reduce anxiety. It won't improve your aerobic capacity, but it will reduce anxiety. Isn't that cool? Okay? And how long do the results last? How long is the anxiety reduced for? 6 hours. So that's pretty cool. For a 10 to 15 minute time investment, your return on that investment is 6 hours. Now that's significant, okay? And no real side effects, other than looking better, feeling better, being leaner, maybe being a little bit stronger. Now, we talked about state anxiety. Let's talk about trait anxiety. Again, let's review. What's the difference between state anxiety and trait anxiety? Yes?
State is a situation that you're in,
Yes.
whereas trait is a characteristic.
Correct. State is situational, okay? And trait is personality. So now we've talked about state anxiety thus far. Now let's talk about trait anxiety. What's the minimum amount of time it takes to see results for trait anxiety, how you are as a person? 8 to 10 weeks. Between 8 and 10 weeks, you can actually modify your personality, your characteristics. You can be a less anxious person with consistent exercise for 8 to 10 weeks. Okay, that's pretty cool. What else? Intensity and duration. Well, in one study, they actually looked at that. So here's what they did. They took 94 healthy but sedentary adults, and here's what they did with them. Group 1, they made them do 10 weeks of running at 60% of VO2 max 3 times per week. Anybody know what VO2 max is? VO2 max is your maximal aerobic capacity. Unfortunately, in this study, that's what they used. But outside of laboratory settings, we can't really measure our VO2 max. However, we can measure our heart rate max, our maximal heart rate. Generally speaking, 60% of your maximal aerobic capacity corresponds to 70% of your maximal heart rate. What is your maximal heart rate? The formula for that is 220 minus your age. If you're 60 years old, your maximum theoretically is 160. Okay, and you take 60% of 160. Any accountants or engineers in the room? Can you help us out? What's 60% of 160? Well, 50% is 80. 100% is 160. 75% is 120. Come on, help me out, engineers, accountants. Natasha, you've been volunteered.
For what? Sorry, I was sleeping.
Okay, so anyway, 60% of your VO2 max, okay? Or 70% of your heart rate max. So it should be close to 120 beats per minute if you're 60 years old. But again, there's your formula, 220 minus your age, okay? So group 1 did that. Group 2 did the same thing, same time, same amount of, same duration of weeks, but their intensity was different, 75%. So one group did cardio at 60% of their maximal aerobic capacity. One group did it at 75%. Everything else was kept constant. Everything else was the same. Duration was the same. Frequency was the same. Everything was the same. The only difference was intensity. What were the results? Well, group 1 reduced their trait anxiety. Group 1 is a lower intensity group. So they were less anxious after 10 weeks. Group 2 actually didn't reduce trait anxiety, which is interesting because they exercised at a higher intensity. So theoretically, they would have seen greater improvements in their aerobic capacity, in their endurance, their stamina, but not in their mental health. So when I use the word exercise prescription for anxiety, you see that sometimes fitness doesn't always correlate with mental health. Isn't that interesting? So any ideas on why would a higher intensity, which would make you fitter, produce a worse result in your mental health?
Aggression.
Sorry?
Aggression. Like it's aggressive.
Aggressive, yes. And, yep,
Putting too much pressure on myself.
putting too much pressure on yourself. So here's my theory on that. 75% is what corresponds to what's called the lactate threshold. The lactate threshold is the point at which your muscles start to burn. You know how if you lift weights enough or you run enough, you actually start to feel a burn in your muscle? That's called lactate or lactic acid, okay? Which is uncomfortable. It's burn, right? Feel the burn. And so if you know that you're going to be exercising at an intensity that's going to produce a mildly uncomfortable sensation, it might increase anxiety in a person who's already anxious to begin with. Okay? You have to take the population studied into account. 75% might be just fine for a person who's not anxious. For a person with anxiety, it might not be the best thing for mental health. It might improve their aerobic capacity better, but it won't do much for their mental health. So lower intensity in this case is actually better than higher intensity. Okay? Moving on. What about severe anxiety? So right now we're talking about mild to moderate anxiety. It's clinical, but it's mild to moderate. What about severe anxiety? Severe enough to be hospitalized. Well, that's what this research investigated. In this study, researchers took subjects who were 36 patients and they were hospitalized for anxiety. Their anxiety was severe enough to be hospitalized. What did they do with them? For 8 weeks, 5 days per week, they exercised at 60 to 70% of their aerobic capacity for an hour. Okay? It's a lot of exercise. 5 hours of cardio per week. What did they see with them? Significant reductions in anxiety. Okay? The exception was patients with social phobias. So if there was an anxiety of unknown origin, there wasn't a specific stimulus, there wasn't a specific trigger, exercise helped. But when there was a specific trigger, like you're afraid of being out in social situations, it didn't help. Which is interesting, because in this study, this was used as a standalone therapy. Whenever you're conducting a study, you have to isolate one variable. So you can't put them on medications and give them exercise, you have to do one, okay? Because if you put them on 2 or more, you don't know what to attribute the changes to. Is it the medication or is it the exercise? So here it was used as a standalone therapy, no medications. With exercise alone, granted 5 hours of exercise and at a fairly high intensity, people were able to reduce their trait anxiety, even though they were hospitalized for extremely severe anxiety. Okay? Yes?
Is it okay if I ask a question?
Absolutely.
Just really quickly, were they exercising before they were hospitalized?
Good question. The question was, were they exercising before they were hospitalized? No. Okay. Other questions? Yes?
Your source, the name of the study?
Okay, source name of the study? Email me and I'll let you know. Yes? One second, I'm going to give you the microphone.
With anxiety, people get hospitalized?
So the question is, with anxiety, do people get hospitalized? If it's severe enough, yes. Most of the time, no. It's uncommon. Sometimes they have to take medication, but if they're part of a study, they don't. Other questions? Great. Moving on. Here's a case study. So bringing this all together, I talked about a lot of studies, a lot of both practical stuff and theoretical. Here is an actual case study of one of our clients. His name is Pierre. He was 69 years old when he started with us, and he was having severe panic attacks about twice a week. Okay, and this was going on for about 2 years. Okay, anybody know what a panic attack feels like? Yeah, a lot of heads nodding. For those of you who don't know, it's between 2 and 5 minutes where you really believe you're going to die within the next few minutes. Okay, that's a severe panic attack, and he was having that twice per week for 2 years. Okay, as a result of a few changes we made with him in his exercise, nutrition, and supplementation, and we worked together with his doctor, we worked together with a pharmacist, etc. Right now, at age 71, he only gets 1 panic attack every 2 months instead of 2 per week. Okay, now again, that's more In the practical world, when you're conducting a study, when I isolate one variable, we have a lot more tools in our arsenal, like not just exercise, but also nutrition and supplementation, which I'll talk about later. But when you combine all three, you get results that are better than just anything by itself. Okay? So that's as it pertains to practical issues. Now, so a summary. What do we know about exercise for anxiety? Cardio has greater anxiolytic effects than strength training. Anxiolytic means anxiety reducing. Okay, so cardio is better than strength training as it stands right now, in our current knowledge, than strength training for anxiety reduction. What else do we know? The minimum time required to see reductions in anxiety is 10 to 20 minutes. That's independent of any improvements in your aerobic capacity. The optimal intensity is 70% of your heart rate maximum. So you start to feel your muscles burn at about 85% of your maximal heart rate, but at 70% your muscles don't burn. You're going to be slightly out of breath, but you won't feel the burn yet. Okay? So now you have the exercise prescription, so to speak, for anxiety. Okay? So we have the intensity, we have the duration, and we have the type. Okay? Any questions? Great. Moving on. Depression. Who can give me a definition of that? Who can give me the definition or diagnostic criteria of depression? Yes?
Feelings of sadness for a persistent amount of time.
Correct.
6 months.
Feelings of, very good. Feelings of sadness for at least 6 months. Yes? Loneliness, kind of related to sadness, yeah?
I have this right after a psychiatrist. I asked him about depression. He said usually it is a disorder, brain difficulty.
Yeah. So,
It's
yeah.
missing. So that's why they give the education.
Right.
Replace it. That's why they look up. Actually, you can say that it is physical
Yeah.
disorder.
Yeah. So it's an imbalance in the brain chemicals and the neurotransmitters, and that's partially true. Yeah. Anything else? Yes.
It has to, in some way, impact your either social or professional life.
You guys are picking up on this. Very good. It has to cause occupational or social impairment. So there's 9 different symptoms. So some of them are, yes, you guys mentioned some of them. It has to cause sadness. You have to have a loss of pleasure in activities that you previously had pleasure in. You have to have a difficulty sleeping. Okay. You also have to, so you can gain weight or lose weight without trying. Okay. And so there's 9 symptoms, and these are 4 of the 9. In addition to that, it has to persist for longer than 6 months. It has to cause social or occupational impairment, and it cannot be attributed to any other medical conditions or medications. If you can meet all those criteria, you actually have clinical depression. Okay? Now, how should we exercise if we have depression? Well, in this study, they compared exercise versus other therapies. So they took 28 men and women with moderate depression. Not severe, not hospitalized, but moderate. What did they do with them? For 10 weeks, Group 1 did behavior-focused time therapy, so psychotherapy. Group 2 did psychodynamic therapy, which is another type of psychotherapy. And Group 3 exercised. They walked or ran for 30 to 45 minutes, 3 times per week for 8 weeks. What do you think the results were? Yes?
Group 3 would have the better results.
Group 3 would have better results. Good,
Yes.
good guess. The results were as such. Just on the exercise side of things, 6 out of the 8 people in the exercise group were symptom-free in 3 weeks. Symptom-free. And they weren't just, it's not just they had the blues, they actually had clinical anxiety, which lasted 6 months or longer and caused social or occupational impairment. In 3 weeks of exercise, 6 of the 8 exercises were symptom-free. 1 of the 8 was symptom-free in 10 weeks, so it took them a little bit longer, and 1 of the 8 showed no improvement. Okay? Makes sense. Nothing works 100% of the people for 100% of the time. But as a standalone therapy, like they took no drugs, they had no psychotherapy, all they did was exercise, and again, 7 out of the 8 showed improvements in a fairly short period of time, two and a half months. Okay? What else? 1 year after the study, this is the cool part. 1 year after the study, 80% of the people in the exercise group were still symptom-free. So basically, after the study ends, the participants are free to do whatever they like. They can continue exercising, they can stop exercising. They can continue seeing a psychotherapist, they can stop seeing a psychotherapist. Totally up to them. So, 80% of those were symptom-free because they continued exercising. They chose to exercise. Okay? 1 year after the study, though, only 50% of the people in the psychotherapy group were symptom-free. Makes sense. To benefit from psychotherapy, you need a psychotherapist, right? To benefit from exercise, you need a pair of shoes and desire. Okay? Yes?
For the exercise, does it have to be continuous, or is it something that can be, broken down? Like,
Are you asking about intervals versus non-intervals, or are you asking about if you exercise for a few weeks and then you stop?
Sorry, in the interval time. So if you're saying 30 minutes or 45 minutes, 15
Yeah.
minutes throughout the day to make up the 45, or continuous 45?
Great question. So intervals versus continuous, we have no research on that. In all these studies, it's continuous. My guess would be that intervals are fine as long as you don't go into an intensity zone that causes excess anxiety. Okay? So aerobic intervals are fine, anaerobic intervals probably not, but again, that's a guess, not based on research. In a few years, we might have the research. Okay? Any other questions? Right. Now, so we know, sorry, back up, yeah.
Was that running inside or outside?
Yeah, indoors versus outdoors, indoors.
Indoors?
Indoors, yeah, so on a treadmill. It would have been cool to see, to compare all the same intensity, duration, and all that stuff, indoors versus outdoors. Yeah, exactly. Yeah, it's usually even better, but even just on a treadmill was good. Yes?
Was strength training incorporated into this exercise program?
Strength training was not incorporated. Usually when they study, they need to assess one variable. So if you do both strength training and cardio, you don't know what's the beneficial effect. Okay, so no strength training in this study, yeah.
Can you just review what it was that they did? Can you just review what they did?
We'll review the protocol, sure. Here's what they did. One sec. So the exercise group walked or ran at 30 to 45 minutes, 3 times per week for 8 weeks. Cool?
The heart rate, was that important?
That was important, but not mentioned in the study. I'm going to guess between 60 and 70% of maximal heart rate, because that's usually where they fall. Okay, now let's compare. So this was just exercise, and this was just specifically cardio. What about when cardio is compared directly to strength training? Remember what was cardio compared to strength training and anxiety? Which one won out?
Cardio.
Cardio was better for anxiety. Does anybody think it's different for depression? Yep. Why?
I'm not sure. It's a feeling of accomplishment.
Yeah, feeling of accomplishment. Great. Anybody else? Yes.
What is the impact of more oxygen to the brain through these studies?
What is the impact of more oxygen to the brain? They didn't measure that part, but we all know that exercise improves oxygen to the brain. Having said that, we're going to cover the issue of iron deficiency, B12, and all that stuff a little bit later. Yeah, but I mean, in these exercises, they asked the quantum variable, which is mood. So they didn't even measure how much improvement did they make in their organ capacity. Yeah. Okay. So in this slide, they compared strength training versus cardio. Here's what they did. They took 40 women with depression. So they didn't study men, okay? So they took 40 women with depression, and what they did with them is group 1 was control group. They did nothing. If they were couch potatoes, they continued being couch potatoes. If they exercised, they continued exercising. So they were given no instructions. Group 2 ran 4 times per week for 30 minutes. Group 3 lifted weights 4 times per week for 30 minutes. The results were this. The control group had no change, to be expected. You do nothing, well, nothing changes. Then both exercise groups decreased their depression symptoms by about 50%. So strength training and cardio were equal. So it's really a matter of preference. If you like lifting weights, lift weights. If you like going out for a walk and going for a run, do that. Okay? So in this case, there was not much of a difference between the two. Now, in another study, exercise was compared to medications in severe depression. Again, severe enough to be hospitalized. So what they did is they took 156 adults with major depression, not mild or moderate, but major depression. And they put them in a few different groups. Group 1 did aerobic exercise, cardio in other words, 3 times per week for 45 minutes for 4 months. Group 2 took Group 2 took Zoloft. Group 3 took Zoloft and exercised. So they compared these groups to each other. What happened? Any guesses what happened? Yes?
Group 1 had the most success.
Group 1 had the most success, correct. In one measurement. Another measurement was fairly equal. So here's what happened. 60 to 70% of people in all three groups improved significantly. So the amount of improvement in all three groups was virtually identical. But that's not the cool part. The cool part is this, 10-month follow-up. So after the study ends, again, people can choose to continue exercising or they can choose to stop exercising. They can choose to stay on Zoloft or they can stop Zoloft. Okay? So 10 months, so a 10-month follow-up, here's what happened. Group 2, the group who only took Zoloft, 38% of people had a return of their depression. Okay? Makes sense. Group 3, that did Zoloft plus exercise, only 31% of them had a return of their depression. Group 1, that exercised alone, only had an 8% return of their depression, which is cool. So exercise alone is better than exercise plus medication. Cool stuff, eh? Yeah.
Would this apply to children as well?
Good question. Will this apply to children as well? The answer is you can, from any study, you can only generalize to the population study. In this case, they studied 40 women. So with this, you can't generalize to children, you can't generalize to men. We just don't know. Okay? But we can say that for women, that goes.
Have there been any studies on children?
Don't know. Personally, my company doesn't work with children, so we don't really delve into that area. Any other questions? Great. Now, in another study, exercise was compared to traditional therapy and again, severe depression. Not just mild, moderate, but severe depression. And what is traditional therapy in depression? There's two types. There are drugs and there's psychotherapy. So what did they do? 49 people, so the researchers took 49 people who were hospitalized for depression and they put them into a few different groups. For 9 weeks, group 1 did psychotherapy plus occupational therapy and they took antidepressants. Group 2 did the same thing as group 1, but they added exercise. In group 3, sorry, that just two groups. The exercise was this. They did aerobic exercise at 50 to 75% of their maximal aerobic capacity for 1 hour, 3 times a week. Okay? Everybody get that? Great. The results were these. Group 1 reduced their BDI score by 19.4%. What is a BDI score? BDI stands for Beck, B-E-C-K, Depression Inventory. So again, you can't measure depression and anxiety through blood, you can't measure cholesterol, you can't measure the way you can measure cholesterol or blood sugar, so you have to go by symptoms, by questionnaires. So the questionnaire used for anxiety, as you saw earlier, was the State Trait Anxiety Inventory. The primary questionnaire used to evaluate depression is called the BDI, Beck Depression Inventory. There's another one called the POMS, Profile of Mood States, but in this one they use the BDI, okay? So the results of this study is group 1, that's the group that was on antidepressants plus occupational therapy plus psychotherapy. They reduced their depression scores by 19.4%. Group 2 that did everything that group 1 did plus exercise, they reduced their depression score by 48%. Again, the only difference was exercise. Now, what do you think in the follow-up, when the researchers asked the subjects, what do you think was the most beneficial part of your treatment? What do you think group 1 said? Yes?
Psychotherapy?
Psychotherapy? No. They said drugs. What do you think group 2 said? Exercise. Correct. That's exactly what happened. Okay? So a little case study, Jennifer. When Jennifer started working with us, she was 53 years old. And interestingly enough, well, recently divorced, her mother passed away recently as well, within like 1 year, and she had certain issues going on, and of course, with 53, she was going through menopause. So a bunch of stuff going not in her favor. So all of a sudden, about 51, 52, she started developing depression, and by the time she came to us, she was on 2 different antidepressants. As a result of implementing what we're talking about here, plus nutritional changes and supplementation changes, she was able to be a lot better in a period of about 3 to 6 months. Okay, she was able to start going out more. She had more energy. She was able to get more done in her day. So she was a lot happier. She was able to be, let's say, a more productive person. Okay, she was also able to get her doctor to reduce the dosage of her medications. So she was quite pleased. So summary. What do we know about exercise for depression? Cardio and strength training have similar effects on depression, but they don't on anxiety. Okay, specificity, right? Just because it's good for anxiety doesn't mean it's good for depression, and vice versa. In this case, they were equal. Strength training, cardio are equal. Yes. if somebody has both anxiety and depression, again, with strength training for anxiety, we only know the one training protocol that's not effective. We know that 60 to 70% at 30 minutes is not effective. What about lower intensity? We don't know. What about recovery period? We don't know. In our practice, we always incorporate both. Strength training plus cardio in a way that improves a person's mental health. Okay? Everybody responds differently, and you have to assess each person's individual responses to different training protocols and nutrition. Okay? So, cardio and strength have similar effects for depression. Exercise is easier to maintain than psychotherapy. Again, makes sense. To maintain psychotherapy, you need a psychotherapist. To maintain exercise, you need running shoes and desire. Okay? We also know that exercise has similar depression-reducing effects compared to medications. That's just on the good side. Okay? On the lack of side effects side, well, the side effects of drugs are weight gain, poor sleep, a bunch of other stuff. The side effects of exercise is looking better, feeling better, and being more fit. Okay? Pretty good side effects. Minimum frequency for exercise to be beneficial is 3 times per week. Okay? So that's interesting because the minimum frequency necessary for aerobic benefits is twice a week. Okay? So you can improve your cardiovascular fitness on twice a week, but for mental health benefits you need at least 3. That's a minimum. Minimum duration is 20 minutes. Okay? So whereas in anxiety 10 to 15 minutes was the minimum effective dose, with depression you need a little longer, you need 20 minutes. And the intensity needs to be about 60 to 80% of your maximal capacity, which is a little bit higher than for anxiety. With anxiety, if you exercise at a high enough intensity, it actually increases anxiety. Here, with depression, you can actually exercise at a slightly higher intensity. Okay? So again, specificity of the treatment, so to speak. In this case, the treatment is exercise. So why does exercise work? So there's a few different hypotheses. I'll mention 6 over here. Hypothesis number 1 is the self-efficacy hypothesis. With anxiety and depression, you feel like things are outside of your control. Okay? Now, by going through exercise, you realize that you can actually control how you feel, your mood, your energy levels. People notice that they exercise, they feel better within a few minutes, maybe a couple hours. Okay? So they puts them back in their control. They want to feel good, they exercise. Okay? So that's one hypothesis, the self-efficacy hypothesis. Hypothesis number 2 is what's called the time-out hypothesis, or the distraction hypothesis. Okay? It's pretty simple. Us humans can only think about one thing at a time. Unless you're a woman, then you can think about a lot of things at a time. I once saw on Facebook that being a woman is like having a browser open with 15 different tabs on it. Right? But anyways, the distraction hypothesis. Since we can only think about a limited number of things at once, if you're exercising, you're thinking about the weight you're lifting, if you're thinking about the muscle working, then you're going to not think about whatever is stressing you out. Or at least not think about it as much. It occupies more brain space, the fact that you're breathing hard and the fact your muscles are burning. Okay? So that's hypothesis number 2. Hypothesis number 3 is what's called the serotonin hypothesis. So if it's the serotonin hypothesis, why do we have a picture of a turkey on here? What's that?
Tryptophan.
Tryptophan. So let's back up a little bit. Serotonin is the brain chemical that makes you feel relaxed. And if you have anxiety, you don't have enough serotonin, or you have serotonin resistance. Serotonin, might have enough serotonin, but it's not getting into your brain cells. Or that serotonin is getting destroyed too quickly. Hence the use of SSRIs, selective serotonin reuptake inhibitors. That's the drugs used for depression primarily. So what increases serotonin in the body? Something called tryptophan. Tryptophan is an amino acid, okay, which is a component of protein that gets converted to serotonin. And turkey has a lot of tryptophan. Anybody ever feel sleepy after Thanksgiving dinner? Well, tryptophan gets converted to serotonin, and serotonin gets converted to melatonin, which helps you sleep. Okay? So that's hypothesis number 3. Hypothesis number 4 is cortisol and norepinephrine sensitivity. When you're under stress, you release certain hormones. Those hormones are cortisol, and you release a neurotransmitter as well as a hormone called norepinephrine, or noradrenaline. Now, if you release it a lot of the time, your body starts to ignore that message. You become less responsive to stress. That's not good. You want to be responsive to stress to mobilize your resources, to mobilize your mental energy to cope with stress. Exercise helps you resensitize your body to cortisol and to norepinephrine. Anybody ever heard of insulin resistance? Okay, insulin resistance is when your body doesn't get the message of insulin. you can get a resistance to every single hormone, including cortisol and norepinephrine. Exercise helps you restore cortisol and norepinephrine sensitivity. Okay? So that's hypothesis number 4. Hypothesis number 5 is increased alpha wave activity. So the brain emits electromagnetic signals. And if you measure them, you would use a device called an electroencephalogram, EEG. The brain produces 4 different brainwaves: alpha, beta, gamma, delta. Alpha brainwaves is the ones we produce when we're daydreaming or in those moments between awake and asleep. Beta brainwaves is the ones we produce when we're actively concentrating. Like right now, you're probably producing brainwaves. When you're in deep sleep, you're producing theta and delta waves. The problem with the issue in people who have a lot of anxiety, they don't produce a sufficient amount of alpha waves. Okay? Alpha waves is the ones you produce when you're relaxed. And in anxiety, you're not very relaxed. So not enough alpha waves. And exercise helps you increase alpha wave activity. It helps your brain function better. That's hypothesis number 5. And hypothesis number 6 is decreased muscle tension. Okay? Anybody ever heard of something called cognitive dissonance? What is it? Yes?
Is it when you believe one thing, but your behavior is different?
Yes. It's when you believe one thing, but your behavior is different. Sometimes, beliefs determine behaviors. Other times, behaviors determine beliefs. So, for example, in one study, they made two groups of participants watch a movie. It was the exact same movie. At the end of the movie, they asked the participants in both groups, how happy are you? Group number 1 just watched the movie. Group number 2 watched the movie with a pencil in their mouth. They were like this, while watching the entire movie. All hour and a half of it. Okay? And again, group 2 reported feeling happier at the end, even though it's the same movie. Why is that? Well, they inferred that my mouth is in this position, which resembles a smile. Therefore, I must be happy. They weren't happy to begin with. They inferred that unconsciously. They didn't actually consciously go through that process. They just inferred that from their own behavior. That's called their dissonance. Well, the same thing happens in the body. You figure, well, my muscles are tense. Why are my muscles tense? I must be tense. I must have anxiety. So you have anxiety. The opposite is also true. If your muscles are relaxed, then you perceive yourself to be a relaxed person. Then you don't go through that process of my muscles are tense, therefore I am tense, therefore I have anxiety. So cognitive dissonance. So you, first of all, you relax your muscles, and that, therefore, affects your brain, okay? Affects your thoughts. So those are the 6 different hypotheses about why exercise works so well. Now, moving on to nutrition side. Nutrition for mental health. The brain needs 3 things for good health. Number 1, it needs oxygen. Number 2, it needs glucose, sugar. Okay? The brain runs on sugar. And number 3, it needs stimulation. Okay? So just having oxygen and sugar is not enough. You actually need some mental activity. So a lot of people, when they're retired, that's when their brain starts to decline. Why? Because the stimulation of work isn't there. That's what they say, do a puzzle, learn a new language, go travel, look at photos from decades ago, etc. All ways to help you stimulate the brain in different ways. So you need stimulation, you need oxygen, and you need glucose. The first 2, how do you get oxygen and glucose into the brain? Exercise is pretty good, right? If exercise gets the blood moving, well, the blood will move out to the brain, okay? And it will carry with it oxygen as well as glucose. How do you do stimulation? Well, I mentioned that earlier. Puzzles, actually working at your job,